Welcome to the Fatty Acid Forum, sponsored by Virtus Nutrition. Join Dr. Barry Bradford from Kansas State University as he looks into how the immune system of a dairy cow responds to a challenge. Here's Dr. Bradford.
Let's talk about how the immune system of the dairy cow responds to an infectious challenge. We'll start off with talking about the common challenges that dairy cows face, go through how the immune system actually first senses that pathogen entering the system, and how it calls in the reserve troops from the immune system to fight the battle with the pathogen. Then we'll go through some of the systemic responses to that infectious challenge, as well as additive effects, including non-pathogenic factors that influence the overall response to an infection. So, as most of you know, mastitis and metritis are the two most common infectious diseases that dairy cows face, mastitis being an inflammation of the mammary gland, and metritis an infection of the uterus. In addition, respiratory infections are an important factor, especially in younger animals, but also in early lactation. So how does the animal respond to this? Well, when a pathogen first enters the system, there are resident immune cells in all different tissue types, including cells such as macrophages that are sitting there waiting for pathogens to enter so that they can respond. And as is shown in this picture, macrophages may engulf and destroy those pathogens and hopefully display antigens, but they're also going to release signaling compounds known as cytokines. And those cytokines help to recruit other key phagocytes, such as neutrophils, to the site of infection to help clear out the pathogens. Now, there are also other resident cells that can help sense this, including mast cells shown near the top and dendritic cells not shown in this picture. But the key point is that the sentinel cells that are recognizing the invasion are sending out signals to drive a number of responses. First of all, as shown with the mast cells, they release nitric oxide, which can help increase blood flow to the local area through vasodilation, and along with cytokines that are specifically activating neutrophil recruitment mechanisms, both of these things help to bring in the phagocytes to help fight that battle. So once the neutrophils have made it to the site of infection, they're also going to contribute to this cytokine response. And so we very quickly get a rapid escalation in cytokine concentrations. So what does this actually do for the animal? Well, it's going to promote an even further inflammatory signal release by other immune cells in the area. And we'll talk about that a little bit more in a minute. In addition, they provide a connection to the adaptive immune system by stimulating some of the B and T cell functions that we rely on for antibody production. They also ramp up the rate of development of new immune cells in bone marrow so that the next round of phagocytes and sentinel cells are being produced during this infectious process. In addition, the cytokine response includes a sort of pre-programmed resolution phase. So if everything works as it should, a number of hours after this ramp-up of inflammatory cytokine release comes a wave of anti-inflammatory cytokine and anti-inflammatory lipid mediator release that help to tone down that inflammatory response that has just been initiated. So the cytokine storm was creatively shown in this image here, and really the point is that we can get a very, very rapid escalation in these signals in a short period of time because they trigger their own release in other cells. And so we're talking about log phase responses with cytokines as opposed to other hormones that we might be used to thinking about in reproductive changes or in metabolic control. And just as an example of this is data from a study published in 2000 in Journal of Dairy Science, and it shows how cows responded to an induced mastitis case. So in this situation, within 12 hours after a pathogen being injected up the T canal, you can see there was about a 1,000-fold increase in plasma TNF-alpha concentration. So this is not even the local concentration in the mammary gland, this is the systemic response. So what are some of the effects of that magnitude of a response? So although we think of cytokines as being primarily mechanisms for immune cells to communicate with other immune cells, basically most organ systems in the body can respond to those cytokines. And so the effects of these big ramp-ups in systemic cytokine concentrations lead to a lot of effects beyond just activation of the immune system. That includes fever, poor appetite, decreased physical activity, and actually you start to get some catabolism or breakdown of tissues, including muscle. And liver changes its function and works less at its normal roles and instead performs what's called an acute phase response, which I'll talk about in the next slide. Increased heart rate, increased respiratory rate, basically all the things that you typically see in a diseased animal that has really severe inflammation are actually due to these inflammatory signals and not due to the pathogen itself or any sort of disease process per se. So just as an example, when inflammation results in very high levels of inflammatory cytokines in the bloodstream, this causes an impact on the liver known as the acute phase response, and we get a big increase in certain proteins being produced by the liver, including the ones shown here, fibrinogen, serum amyloid A, C-reactive protein, haptoglobin, and others. And one nice thing about this is, from a research standpoint, is this allows us to sort of non-invasively assess the level of inflammation in the liver, because when these proteins are found in the bloodstream, the majority of that comes from the liver itself. Just to demonstrate the fact that many things can have an impact on systemic inflammation because of the release of activators such as cytokines and eicosanoids, we can get inflammation related to the infectious diseases that we've talked about, but also there's a number of other cases where there may not be any pathogen involved at all, such as the leaky gut syndrome that's receiving a lot of attention now. If it's common that endotoxin or lipid polysaccharide actually leaves the gut, that also can cause systemic inflammation. And also some other things, including social stress, which is surprising, and it's not really known whether there's adequate social stress in a typical dairy cow to cause an elevation of catecholamines that lead to inflammation per se, but it has been shown in shipping stress studies and similar types of interventions that this can actually result in acute phase protein response. So it's rather surprising actually how many different stressors can contribute to this additive effect on inflammation. And just to highlight the fact that this is a particularly pressing issue in transition cows, this is just data from one study that correlates with many, many others, showing dramatic increases in acute phase proteins, in this case haptoglobin, in the first few days after calving. And this is the time when cows are also at greatest risk of metritis, mastitis, metabolic diseases, and all this range of things that help lead to early lactation being a high-risk time for these cows. So ideally, the dairy cow responds to immune challenge by rapidly recruiting immune cells that will eliminate the pathogen, that will contribute to clearing out tissue damage from that infection and fixing the damage, and rapidly resolving the inflammation so that the cow's physiology can return to a normal state as quickly as possible. And really that rapid resolution is a critical part of a healthy immune response, because that's what prevents the collateral damage that's associated with sustained inflammation. So in many cases, infections actually are causing damage because of the immune system itself.